Good day everyone! Today, we explore two critical topics in global population dynamics: mortality and child fertility. These concepts are closely intertwined and play a significant role in shaping democratic, social, and economic landscape of our world. We'll cover the definitions, trends, contributing factors, and broader implications of mortality and child fertility rates. Globally, let's start by defining what these terms and means.
What are mortality and child fertility? Mortality refers to the incidence of death in population, commonly measured by the mortality rate, which is the number of deaths per 1,000 individuals annually. It includes specific rates like infant mortality and maternal mortality. Child fertility, on the other hand, is closely related to the total fertility rate or TFR, representing the average number of children a woman is expected to have during her reproductive years. These metrics are critical indicators of public health, economic development, and social progress.
So next is global trend mortality. Globally, mortality rates have significantly declined over the past century, largely due to improvement in healthcare and nutrition and sanitation. Child mortality has decreased from 18.2% in 1960 to just 4.3% in 2020. According to the World Bank, life expectancy has risen from around 52 years in 1960 to over 73 years in 2023.
However, disparities remain. For example, Sub-Saharan Africans still struggle with high child mortality rates due to limited access to healthcare and malnutrition.
Trends in child fertility. Child fertility has also experienced dramatic change over time. The global fertility rate has fallen from about 5 children per woman in the 1960s to approximately 2.4 today. This decline is driven by factors such as improved education, particularly for women, increased access to contraceptions, urbanizations, and shifts in societal norms about family size.
Despite this advance, some regions, particularly in developing countries, still experience high rates which can strain resources and impact development.
The interconnection and mortality and fertility. Mortality and fertility are deeply interconnected. Historically, high mortality rates, particularly among infants and children, lead families to have more children to ensure some survive to adulthood. As mortality rates decline due to better healthcare, families tend to have fewer children. This phenomenon is known as the demographic transition, where societies move from high mortality and fertility rates to lower levels as they develop.
Case study example, countries like Bangladesh and Vietnam has experienced rapid declines in both mortality and fertility due to targeted public health initiatives.
Implication for society and policy. Why do these trends matter? As seen in Japan and parts of Europe, declining fertility can lead to aging population, impacting labor market and social security system. High fertility and mortality rates in developing countries can create challenges like poverty, resource scarcity, and limited access to education.
To address these issues, governments and organizations must focus on 1. Improving healthcare access to reduce mortality. Promoting education and family planning to manage fertility rates. Investing in policies to support aging population where fertility rates are low.
In conclusion, mortality and child fertility rates are vital indicators of society well-being and development. By understanding their trends and interconnection, we can address challenges more effectively and work towards sustainable development goals. Let's advocate for continued investment in healthcare, education, and social system to ensure a balanced and equitable future for all.
Possible solution to maternal and child mortality. Reducing maternal and child mortality requires a comprehensive approach that includes improving access to quality healthcare, ensuring skilled birth attendance, and providing emergency obstetric care. Education awareness programs are crucial to informing women and families about prenatal care, proper nutrition, and recognizing danger signs during pregnancy. Expanding access to family planning services can help women space their pregnancies and avoid unintended ones, reducing the risk of complications. Additionally, implementing nutrition programs for mothers and children strengthen health systems and addressing social determinants of health such as clean water, sanitation, and gender inequality are essential to ensure mothers and their children's and health well-being. Thank you.
There are a lot of great ideas out there on how to reduce maternal and child mortality. A lot of things have been tried. Some have been effective, many have not been. And so we're trying to give policymakers a clear, concise idea of the causal evidence around a menu of interventions that they can choose to go out and reduce the number of deaths of mothers and children around the world. Since 1990, maternal mortality rates have fallen by 47%. But the Millennium Development Goals established by the broader development community, the United Nations, the World Bank, and others, is to reduce that number by 3/4. So there's still a long ways to go, and we didn't make it. The biggest problem in countries with limited resources is not that we don't know what to do. The bigger problem is, how do we do it? So that's why in this report, we only look at those interventions that actually occurred in a developing country. So there's a track record of this type of intervention actually works in a context like yours. Skilled birth attendance is the primary indicator for the 5th Millennium Development Goal. And we believe that if you increase skilled birth attendance, reductions in maternal and neonatal mortality must follow. So we investigated that. And we found that there aren't any hard, good, high-quality causal impact evaluations out there that can definitively show that increasing skilled birth attendance alone reduces maternal or neonatal mortality. What we do find is that by improving the level of information and training that both mothers have and the birth attendants have, by doing those together and in a localized community way, now we do see a result in reducing maternal mortality and improving the likelihood of survival for babies who are born. For neonatal mortality, we're talking about how to save the lives of children who are less than a month old. In addition to the clinical interventions that tend to work, there is also really nice evidence that improving the home environment can be critically important, specifically the knowledge and information that the mother has. And that can happen through community-based home care programs of training the mother how to take care of her newborn. It can happen through home visits, and improving the levels of education for girls can years later have really robust effects in reducing the likelihood of death for her eventual children. So we see that community health training campaigns are really effective because those start to get at the level of changing norms of how things are done within the community. For kids under 1 and under 5, we found some surprising results. It's not just the health sector, although that can be important. It's also the environment around the child. So education levels, sanitation, improved water quality, even governance, specifically representation of women in government, can all help in reducing the likelihood of death. We've gone to great lengths to collect all of the good causal evidence around what works to reduce maternal and child mortality. We can say with some certainty which interventions are likely to work because they have worked in various contexts around the globe. We see that interventions that improve education for both mothers and for health workers goes a long way to reducing maternal and neonatal mortality. For infant and under 5 mortality, interventions that affect the child's environment, pollution, education of their parents, water and sanitation, and governance are all really effective in reducing the likelihood that they might pass before their time. We want to see these children grow up and move from surviving to thriving.